Good evening. Welcome for all of you for the fifth event organized by Members Benefit Society for the year 2021. Actually, this is the last event we are organizing for the year 2021. So, if I'm not mistaken, we had three events related to COVID within this year. I think Dr. Mahesh participated for two previous events, one Q&A and one other session. So Dr. Mahesh Harischandra is a consultant physician, resident consultant at Lanka hospitals. He is actually not new to child encounters. Previous two occasions, he has shared this knowledge with our own members. Actually, Lanka hospitals has treated for more than 11,000 COVID patients within this year. Out of that 11,000, roughly about more than 2,500 patients treated by Dr. Mahesh Harischandra. So he is having a extensive experience in managing COVID patients. So today's session actually post-COVID management. This Dr. Mahesh is the best person who can talk on post-COVID management as he's having extensive experience on COVID management. So without taking much time, I'd like to invite Dr. Mahesh to enlighten us on post-COVID management and what we are supposed to know on post-COVID management. So, over to you, Dr. Mahesh.
Thank you very much. Good evening to everyone. As rightly pointed out, I have managed a lot of in-hospital COVID patients during the last few months. COVID is a very lethal, devastating illness as well as a very prolonged and very kind of annoying disease sometimes. People who get COVID can have serious problems and they can succumb to the infection. But people who survive the COVID infection sometimes continue to have problems due to COVID infection, unlike the other viral infections that we know. Like, now we know a lot of viral infections are around, but COVID is unique in that. COVID infection has a spectrum in the presentation, and most of the people in unvaccinated population, these statistics are from unvaccinated populations. 80% of the people who get COVID infection either have mild or asymptomatic disease. We know that because most of the people even don't know that they have COVID and they are just spreading the infection. Some people get only few days of cough, fever, body aches. Some people don't even get respiratory symptoms. 20% get moderate to severe disease. And out of these, 15% get moderate disease. Moderate disease is where you get significant respiratory symptoms, sometimes pneumonia as well, but they don't need ICU or critical care. So, but these people usually come to the hospitals for admissions and get in hospital care. Out of this 20%, 5% get severe COVID. In severe COVID, you get lung involvement. The mild cases either get little bit of infection of the throat and nose and upper respiratory tract. Sometimes they don't even get that. But that 5% get significant lung involvement and they can get pneumonia and various other problems. Mind you, these rates are different in vaccinated population, because vaccinated population has immunity. Because of that, most people have mild asymptomatic infection. In my experience, before we successfully done the vaccination, I have been a director to the SPC also, and then during the first few months, we were scared of having unvaccinated people in our country, because unvaccinated virgin populations have a lot of mortality. So that's what we have seen during the last few months. But when you get vaccinated, now our experience, even now the rate of infection is going up, but we don't have much of many ICU admissions and many critically ill patients and many people with pneumonia. So these rates are different now. And if you look at these statistics, you see a lot of people have minor disease, and they even don't go to a hospital. People who get moderate to severe infections can develop certain complications. Those complications are, as we know, it is a respiratory illness. So they develop pneumonia, and when they develop pneumonia, they can't breathe. They develop shortness of breath, and their oxygen extracting capacity goes down, and they can even go to respiratory failure, and they end up in having a ventilator support, and they can die. These people who have critical disease with respiratory tract involvement have a kind of a prolonged stay in the ICUs, and when they are discharged, if they survive, when they are discharged, they continue to have certain respiratory problems because their lungs are scarred, their lungs are debilitated, so they continue to have respiratory problems. In fact, I had a few patients whom I have to send home with home oxygen. So they are on home oxygen and they are coughing, they can't work, they have shortness of breath. But these are people who have had respiratory involvement while they are in the hospital. They continue to have cough, continue to have shortness of breath. And in my experience, during the time that we had height of the COVID epidemic, a lot of people died in the ICUs because if you are put into the ventilator, even in the best of the centers, even in the best of the centers of the world, survival rate is around 20%. Our survival rate is less than that because we don't have, sophisticated care facilities in our country. So, but we did a good job. Certain people have been weaned out of the ventilators and they went home, and they have to be followed up, and I'm following up certain people. I'm very happy to say they recover also. There was one person whose lungs were, about 80% involved, and he couldn't breathe when he went home. He went with home oxygen. Now he's walking back to OPD. You have to do certain rehabilitation care when they go home. So these people are people who have had definitive respiratory involvement and long-term complications. And as you know, COVID is not only a disease of lung. It has so many other manifestations in the other systems of the body. We know cardiovascular system is involved. Many people get heart attacks, and they can develop clots in the lung. And some people develop conventionally a heart attack is when you have a clot in a blood vessel that is supplying the heart muscle. So they do develop clots, and sometimes they do develop myocardial, heart muscle injury also. That myocardial injury happens without a clot also. So we have seen so many people like that, and they can go into heart failure because of that, because the heart muscle is scarred and injured. Some people go home with those problems. And I have seen so many people developing high blood pressure during the COVID infection. People who have not had high blood pressure before suddenly develop blood pressure. So they also go home with the burden of having high blood pressure. So there are so many cardiovascular disorders with COVID as well. So I'm talking about these people who have had moderate to severe disease, and while in the hospital, who have developed these problems. Because they don't recover fast, we have to send them home, because in an epidemic, the problem that we face is we have to keep the turnover going also. Like, you can't keep the patients for a long time. So even in the ICU, it is a very precarious situation. Sometimes, in the ICU, we are stuck with the patient. We can't take him out. But at the same time, in the doorstep, there are so many people waiting. So it is very depressing scenario also when we had severe COVID. I'm a very strong person. There was a period, even I thought, oh, what am I doing? Like, I can't help people. You feel helpless. So in that sense, we are very fortunate now, because the even the number of infections go up. Severe cases are going down due to vaccination. So that is very very important to get the vaccination also done. I thought I heard now government has taken a decision to vaccinate booster vaccination to all people above 30. Today they have started that. That is also very important, because the immunity goes down after 6 months. So I make this a point to emphasize on that as well. So, and there are other diseases also in COVID, kind of other systems that we don't talk much about. That is the neurological problems. I have seen so many people developing strokes, and so many people, especially old people, can suddenly develop dementia. Their memory capacity goes down. They suddenly become very dependent, and some people become depressed, and there is sometimes people develop general loss of well-being. They don't feel good, they feel miserable, and their mobility goes down. And certain people can develop certain nerve paralysis as well, especially when they are put on the ventilator for a long time. They can develop nerve paralysis. So I have had people like this. So when you develop a stroke, that would give you a patient whom we have to follow up for the long-term rehabilitation. So these are some of the neurological problems are common in COVID. And nutritional problems develop. Some people develop anemia, low blood count, and when you are staying in the hospital for a long time, infections occur, increased clotting, and you have to manage the other diseases like diabetes, high blood pressure, because most of the people who develop severe COVID have other comorbidities. So people who are in the hospitals are mostly people with other long-term diseases as well, so they get complicated. So that is the spectrum of diseases and complications you can have in a patient who is in the hospital. So who is having a severe disease and who has had critical disease. Those are the complications of the disease, and these complications can stay for a while, and we doctors have to manage those complications. But there is another concept called long COVID. Long COVID is a scenario where you didn't have severe disease, and then when you go home, like if you can remember, 80% of the people had mild disease, mild asymptomatic disease. They coughed for a few days and then they had mild shortness of breath, mild fever, body aches. But that population sometimes have people, individuals with wide-ranging persistent symptoms. And it is a kind of a very debilitating problem. I have so many people coming back after having mild COVID, saying they can't work, they don't have energy, they lack initiative. Some people are depressed. Some even have chest pains, cough, and shortness of breath. So, in fact, if you go into the history, they have never been to the hospital. So this is a kind of a chronic problem. So the scientific community has to devise a umbrella term for these people. They are now being called long COVID. Initially, the definition was if the symptoms continue more than 4 weeks, they were considered to be having long COVID. About a couple of days back, American CDC has revised the definition, and now they say if somebody had COVID and they have symptoms more than 8 weeks after having COVID, and then those symptoms cannot be explained by one of those complications I was talking about, because those complications are well-known complications. If you have COVID, pneumonia is a known complication. If you had COVID, while having COVID, having a heart attack is a known complication. But these people don't have anything. So that is called long COVID. These people have fatigue, shortness of breath, chest pain, and cough. Those are the most common symptoms. And many people are depressed and they can't work. They don't have energy to work. And some people even develop memory loss. I have seen so many people coming to me telling, Doctor, I had COVID. Now I can't remember anything. And some people develop strokes, nerve paralysis, and runny nose continues to be there in some people. And in COVID, you can lose the sense of smell. Some people take a long time to regain the ability to sense smell, and losing of hair, sweating, diarrhea. So can be very annoying, debilitating, and problematic disease sometimes. But people who have this long COVID, the problem is we can't find anything. We can't pinpoint to a place why these people are getting these symptoms. So essentially, COVID is a very complicated disease in the sense like COVID is an immunological disease. In scientific terms, we know this S protein, spike protein, is a key virus has to enter the cell, and the lock is on the cell, key and lock mechanism like so. There is the key, lock is a receptor. That receptor mediates a lot of physiological actions in the body, regulation of blood pressure, regulation of kidney functions, regulation of vascular tone, blood pressure. So when you have that kind of a disease, the antibodies we develop are antibodies against our own body constituents. That is why this disease is a very wide ranging problematic disease. So these people, the biggest challenge is to find, now say if you have a patient with long COVID coming with chest pain, the problem that we face is whether this is chest pain due to long COVID or whether this is chest pain due to heart attack, because they can develop heart attacks also, right? So we have to carefully assess them, analyze them, do certain tests to see whether we are missing something. If you have long COVID, I mean, like, the most of the time, the management is supportive. We can symptomatically treat and we can follow them up. But hidden inside the long COVID population, there can be people who are having real heart attacks, lung involvement, secondary infections, and clots. So you have to be very careful dealing these people. So internationally, I mean, if you use the scientific data, now in Sri Lanka, we don't have that much of statistics. We are a nation driven by, like, impressions most of the time. So we don't have our own rates. Our Lanka hospital has a good database which we are analyzing. Even in my case, like, I see people with heart attacks. Now, for example, myself, after having the COVID injection, I got a heart problem and I had to undergo bypass surgery. So if I link that with vaccination, that is wrong. That is not the scientific way of doing it. You have to have a big population and see the rates, and then statistically, and I don't have to tell these to accountants, you have to statistically analyze these things and then come to a conclusion whether there is a cause and effect. So, these are internationally practiced norms. Usually, we follow up all the patients who have been hospitalized. That is very important within 1 week of discharge. If you are in the hospital for some reason, so ICC patients and severe patients who had severe symptoms, and especially if you are warded, if you have been warded due to severe symptoms or one of the complications, within 1 week of discharge, we usually get them down to the OPD and we follow them up, do certain tests to see how they do. I will explain a test also. People have comorbidities like diabetes, high blood pressure, previous heart attacks. They run a certain risk of getting their illnesses more severe. Say people who have diabetes, their diabetic control go out of the way. Some people develop more blood pressure. They need more pressure tablets. And some people develop heart attacks. Mind you, heart attacks after COVID has not been statistically linked, because we have so many people who have COVID. I mean, we have millions of people in that population. No, naturally there are heart attacks happening. So we don't know whether there is a cause effect link there, but we see so many people who have had heart attacks after COVID infection. Mild to acute disease, like, people who have been managed at the OPD and, ICC sometimes without any symptoms, if they develop new persistent or progressive symptoms, they usually belong to that group, what we call long COVID. We get them down and then we do certain tests to see whether they are developing one of those complications. So as far as the test goes, we specifically look at their respiratory functions to see whether they have scarred lungs. And we do chest X-rays. Chest X-rays are done. You have to do a follow-up X-ray at least within 3 months' time to see whether they have regained their lung capacity. Some people develop residual scarring of the lungs for life. So follow-up is important. If you had significant COVID infection, if you have been in the hospital, if you had one of those complications, even if you stayed at home, if you had severe disease, it's best to go to a doctor and get yourself checked again to see where you stand with regards to disease progression. So with that note, I will start questions and answers sessions because I think you may be having a lot of problems that I can address. Not the infection. When I got my AstraZeneca vaccination, after about 2 weeks' time, I developed a mild chest pain. I have very bad family history. Genetically, our family is such, we develop young heart attacks. So I got myself checked to find all my vessels are blocked. Again, whether you develop heart attacks after vaccination is not scientifically proven because so many people have got vaccinations. So we don't know whether I belong to a group, whether I was destined to have a heart attack despite getting the COVID vaccination or not, we don't know. So much so, the people told me not to get the second vaccination. But I went ahead and got my second vaccination, same vaccine, AstraZeneca, because the chance of my getting COVID infection after having the bypass and dying out of it is more than the risk of getting, a heart attack again with the COVID vaccination. So I got myself vaccinated. So, but we see a lot of, we hear a lot of stories after vaccination, so and so died. I don't know whether, I think we are linking the naturally occurring events to the vaccination. That is, especially in Sri Lanka, because we don't go by the statistics. Statistically, scientific community has not proven that whether risk of getting a heart attack is more when you are vaccinated. It is not scientifically proven yet. I think benefit is more than the risk. Sorry. Mm-hmm. If I think there is a relationship, there is a relationship, but scientifically I can't say. Because second vaccine, I got the same vaccine, but I never got any problem. I was having blocked vessels anyway. I can't blame the vaccine for that. Long-term effect in the sense if you had severe COVID or long COVID. Because long COVID is an entity happening in mild disease people. If you had complications while you are having the COVID, like if you had been in the hospital, it can run up to months sometimes. Some people, if your lungs are significantly scarred, people sometimes live with oxygen. In other countries, some people are on long-term home oxygen. So it can be a very, very, very bad disease also. Long COVID usually the duration of long COVID is about 3 to 6 months, they say, but some people do have these, lack of energy, depression, aches and pains, chest pain, for even year. So it can be a problem. Questions. There's a question asking, is it okay to get vaccinated when the fetus is below 3 months? I think government has taken a decision to vaccinate all the pregnant women. So for these kind of questions, it is too early to have scientific data. That is, now giving the Pfizer vaccine in Sri Lanka after 3 months or 6 months of the second dose is not scientifically proven. But sometimes the circumstances are such you have to do, practices without thinking of scientific data, because it's like, when you have a fire, right? If you wait to see to get a extinguisher which has been tested before, you burn yourself to death, isn't it? Right? So you have to run, and you have to at least so we are doing sometimes things like that. So I think the College of Gynecologists has taken, obstetricians has taken a decision to vaccinate all the pregnant women, because there is a risk of dying with COVID if you are unvaccinated, because pregnancy is a very high risk population. So I think if you are given the option of vaccination by your doctors, you have to follow it. No questions here. Virus, yeah. Well, you are particularly interested in Omicron, is it? Well, this is the problem in an epidemic, endemic, pandemic, because the virus multiplication rate is so fast and so vast. Always there is room for mutations. When virus multiplies, there is a chance of getting it mutated. Like, we mutate. So all the beings in this world mutate when they multiply. The virus multiplication is very fast, so mutation rate is high because epidemic is growing so fast. So it is natural that we will get so many variants. So these variants can go in two ways. One way is the variant can be more lethal. Those viruses can give us more harm, and they are more easily transmissible as well. So two things. Easily transmissible doesn't mean that it is lethal, right? So if you have the combination of more transmissible lethal disease, that is a very bad combination. That is what has happened with Delta. Alpha was not that transmissible and not lethal. Now Omicron, so what if this happens? It is more transmissible, very easily transmissible, but mild disease. That is how this epidemic is going to end. Whatever we do, epidemic will decide when it will stop. Virus will decide. So if there is a virus, very fast transmission, mild disease, it will sweep across the world and the problem will be over, right? If we develop, if virus develop itself into a strain, more transmissible, more lethal, we will be in deep trouble. So Omicron, we don't know where we stand. We know it is more transmissible. And the third scenario that can happen, because now we are so dependent on our immunization, vaccination. The protection we develop due to vaccination is devised against this spike protein. So the assumption is spike protein will not change, but spike protein itself can change in mutation. So that has happened in Omicron. So the vaccination may not work because the spike protein which is on Omicron is a bit different from the spike protein or the other viruses. So the immunity that we have developed will not recognize. So there is kind of like, room for virus to play around, right? But these are again not scientific data. You have to have a significant length of time to analyze the data to say whether it is a mild or severe disease. So in South Africa, most of the cases have been mild disease. But again, these mild diseases have occurred in populations there had been vaccination. So most people who have got it are vaccinated people. So we don't know, vaccination works partially also. So it is too early to say whether Omicron will be a problem or not. Omicron may stop the epidemic also. If Omicron is a mild disease and more transmissible, it will happen. In fact, even 1989, when there was a pandemic of influenza, there were about 4 spikes, four peaks. The last peak was like that. Last peak, mild disease, everybody got a cold, suddenly it disappeared. So mutations can be harmful as well as sometimes useful. So, well, when there's nothing in your arsenal, you might even use a club, no? So vitamin D story is not, there is no big scientific evidence to say vitamin D helps you, right? They have seen certain people who are vitamin D deficient have developed severe disease. That's all that we have, right? Out of the population who got COVID, some people have had vitamin D deficiency when they had the severe disease. So it is not, conclusively proven that vitamin D deficiency causes severe disease. So this vitamin D has come to arena with that tiny piece of data, because some scientists have seen vitamin D deficiency is there in people who are having severe COVID, right? So vitamin D will not give you a passport to hang around without a mask. So long-term vitamin D, I don't think there will be a harm, because we all are vitamin D deficient in our country. If you check your vitamin D levels, because we have suddenly become indwelling creatures, no? We all are living inside our rooms and we are dark-skinned people. We need a lot of sunlight to convert vitamin D to active vitamin D metabolite. So taking it, I don't think it will be harmful. Believing it like Dhammika Paniya will be harmful. There is a question, interesting question. Is having alcohol bad after COVID? If yes, for how long? Having alcohol is bad anyway. So don't have alcohol. That's my short answer. Again, there's no scientific effect, but if you are severely ill, if you have, if you had severe lung disease, severe heart attack, heart failure, you should not drink. Mild infections, I don't think even I tell not to drink, people will stop drinking. So they will continue to drink. Is vaccine can have tiredness in normal life? Yes. Vaccination is kind of a simulated infection, isn't it? We are giving the part of the virus for the body to recognize that part of the virus, and then we are asking body to develop a mount the immune reaction. So some process happening during the infection, part of it is happening when you are given the vaccine also. So your immune system gets activated, you develop a lot of antibodies. When you are doing that work, again, there is a bit of a drama inside the body. So that is why you get fever, lymph nodes, aches and pains, swelling. Some people even develop serious complications like nerve paralysis, but very rare, mind you, very rare. But these body aches and fever and stuff are very common, no? Because body is mounting the immune reaction. So it is common. It is common. I have seen a lot of people who have tiredness. In fact, I have joint pains to the extent that I think I have a bit of arthritis. But the fact is, to feel that you have arthritis, you have to live. If you are dead, you don't have arthritis. So if you don't get the vaccine, you are dead now. So might as well live with these small nuisances to protect yourself, your life. During the epidemic, as Bhadati told, that I have seen about 2,500, 3,000 people. And I think I had 1 month where Lanka Hospital had about 52 deaths. And among those deaths, I myself had few people dying in my hands. They couldn't do anything. Most of them haven't had either a single injection or they had only one injection. I see very, very rare cases when you had both vaccinations, you have problems. Not to say that fully vaccinated people don't die. There have been cases, but minority, very, very, very rare cases. So get your vaccination. Even you feel horrible, you have to get the vaccination. Otherwise, there's a chance of dying. Can a person get same variant of COVID again and again? Now, this is also an interesting situation. Like, I have seen people coming to me saying, this is the second attack. Sometimes the first diagnosis was not correct. There are instances like that. Recently, I got a patient who said, I got COVID, doctor, and this time I have respiratory problems. So I did an antigen which was positive. So, but during the first time, she didn't have any symptom. Somebody has done PCR. God knows where they do the PCRs. You have to do it in a accredited lab like ours or some reputable labs. There are people doing various substandard tests also. So first diagnosis probably was not correct, right? But there had been cases I have also seen getting COVID for two times. Some people have got it for even 3 times. So this infection is very unique in that. But second infection fatalities are very low. It is again the reports, 1 or 2 reports scaring us. Now, I will give you a good example. Now, it is said that chicken pox you can't get twice, no? Have you seen people who has got chicken pox for the second time? You have. So there are exceptions for everything. So you can get COVID again and again, because we are seeing a lot of people getting the infection. Again, how severe, how damaging the second infection is not yet known very well. So better not to get it. So you can get it second time also. Yeah. Third dose. Again, I think this is a national decision now to give the third dose, right? So whether there is science behind that or not, I am not going to comment, right? Because there was a problem in Abu Dhabi, no? Abu Dhabi of Kuwait. They have given Sinopharm, and Sinopharm, then they were getting another wave, and then they had to give a third dose, and the third dose was Pfizer and AstraZeneca. They have decided on Pfizer. Scientifically, there were 2 or 3 trials in UK and US. When they have given AstraZeneca, they have given the second dose as Pfizer to see whether there is a good immune response. But one thing we know, scientific data shows the immunity that we get from vaccination goes down after 6 months. After 6 months, the antibody levels drop. So based on that, I think it is okay to take the third dose, because newer variants are coming up. And the other issue is now we have to open up the country also. No? We can't close the country because we have another problem now, COVID related and not related as well, but we are in a dire situation. We don't have foreign currency, economic collapse is imminent. So we have to run the country also. So I think it is best to run the country with good immunity and probably accept certain mortality as well now. Right? People may die. This opening will give few people deaths. But if you close down the country, we will have more deaths out of hunger than the COVID. So it's a kind of a balanced thing now. So I think it's sensible to get the third dose as well. Yeah. I know. That is because I think our capacity is full now. PCR, I mean, when I was in the action committee, at the beginning I was there, later I walked out of that. So I was busy as well. In an epidemic, anyway, your capacity runs out. Even US faced that. In New York, the PCR running capacity, when the when the epidemic becomes an inferno, it becomes very severe. Your capacity runs out. When capacity runs out, the detection rate becomes static, isn't it? Because you are running at the maximum capacity. So it is always 2000, 2000, 2000. I don't know how many tests we are doing now. Probably it is a capacity issue. I don't think they are underreporting. I see a lot of people now. Yesterday, I have seen 5 in the family, and they sat in front of me, all 5. One said, "Doctor, my son has COVID. We all are coughing. Please look at us." So people are going to parties. Son has gone to a party. So people are now moving. I think infection is going all over. But there's one silver lining, because though we have a lot of cases, our ICUs are not full. We have only two or three patients in the ICU. There was a time when vaccination was not full. There was a time we couldn't find ICU beds. We couldn't find ward beds, and there were people in the pipeline waiting to come to the ICU. So even it spreads. I think severity has gone down because of the vaccination. Yeah. Yeah. Again, vaccination of children. The world was not very keen on vaccinating children before. I mean, when they wanted to vaccinate the risk population, the risk where we went wrong in Sri Lanka also. There was a point we forgot the risk population. We were trying to vaccinate everybody. Can you remember? Without targeting our vaccination to at-risk population. That is why we had certain number of deaths. Children having severe disease and deaths and severe problems, the rates are very, very low, unless they have a complicated disease or something like that. I mean, internationally, COVID, Pfizer vaccine is given only once because their immunity is already good, So children having it, I mean, we have a big scare, again, emotion driven in our country. I don't see a big problem, Yeah. Yeah. We will never know. We will never know. We will never know. And I mean, it is not important as well. No, even somebody has developed it, they are killing themselves. If China developed it, China has hit hard. No, China is facing economic problems now. I don't think so. I think after some, in fact, I'm proud of myself. Some of the stuff I have predicted when I was in the COVID action committee. I went in front of the TV, also told things happening today. Can you remember the economy and everything predicted about? Just common sense. So I think at the end of this, the countries which will come up will be service-based economies, because they can run their economy while having, the UK will do very well. UK is a small country, manageable country, service-based economy. They will run. They are rolling the economy. China will get hit because you have to have people movement. So factories are closed and all that. I think China is heading for disaster anyway. US, even this is my opinion. Like, we don't know what will happen. I think Japan is doing very well. Have you heard Japan getting hit by this? But Japan, they are rolling their economy. So the rolling economy will be the most important thing after end of this. The nations which will come up will be those nations, I guess. So even it is a lab generated one, what can we do now? We have to face the problems. It will never be proven also. Most problems come to the mother. They get very severe disease, pneumonia, and the mother can die. It can be very severe in pregnant ladies if they are unvaccinated. No new questions here. Sri Lanka has given the authority, no? NMRA has authorized it. I don't know whether we are getting it down. Must be very expensive also. Even now there is an injection. We have concentrate of antibodies, which cost around 230,000. 30,000 rupees. That I have given it to certain people who are having high risk. At the initial point, if you give that injection, you don't get severe disease. I mean, it is not one-to-one, but the risk goes down. I have given it to couple of people. They did well. So medicine also will be very expensive at the beginning. I don't think it is available yet. Somebody should bring it down. Authority has been given now. Anybody who has had COVID here? Okay. Sometimes we may have had it because vaccinated people don't know sometimes, even they get it. I have seen people in the same family, few people have got it, but they were all living together, right? Exposed heavily. But some people don't develop symptoms because they are vaccinated.
So if there's any other question, we can wind up. So Dr. Mahesh, thank you very much for your wonderful session and enlightening us on the post-COVID and what we should do and what we shouldn't do. So again, thank you very much on behalf of members of University of Lanka, members of University of Institute of Chartered Accountants Sri Lanka. And I would like to introduce I would like to call upon our Vice President, Mr. Tushara, for the vote of thanks.
Thank you, Badrijit. Before we turn to the vote of thanks, I would like to invite our President, Mr. Dushpanta, to hand over the token of appreciation to today's speaker, Dr. Harischandra. Thank you, Dushpanta. Now it's my duty to do the vote of thanks on behalf of Members Benevolent Society of Sri Lanka. Dr. Mr. Harischandra, thank you very much for joining with us and sharing your experience, thoughts, and views on how to manage the post-COVID activities. Thank you very much, Doctor. I think Doctor has delivered the third lecture in here on behalf of the Benevolent Society. Thank you, Doctor. We are hoping the future things also from Doctor. Thank you very much. Then my own Vice President, Mr. Badrijit, thank you very much for coordinating this event. Thank you, Badrijit. Then Lanka Hospital Marketing Team, thank you very much, heading by Olindi. Thank you very much for your support, for giving. Then I should thank our Governing Council, our Presidency of Sri Lanka, and CEO Durani Fernando, and her staff for supporting us to have this event, providing all the logistics arrangement and all. Thank you very much. Then I should thank our own committee for organizing this event. Then our CS staff for facilitating all the things. Thank you very much. The members who are here and joining on Zoom platform, thank you very much for participating on this event. Thank you very much.